Good afternoon and welcome from the floor of the Chicago Midwinter Meeting. I have to say, this is the warmest weather I've seen at the Chicago Midwinter Meeting since I've been coming, almost 30 years. And today we are with Dean Kenneth Chance, the Dean of Case Western Dental School, one of the top dental schools in the world. What is so unique about Case Western Dental School is that the dental school is highly integrated into the medical school and the medical part of Case Western, where there is a firm belief that the integration of oral care with healthcare in general is critical. That people that have good oral care, people whose teeth are taken care of, tend to be much more healthy. And there is a direct correlation between good health care and good oral care. So it is really terrific, Ken, to be with you here today. We've had lots of discussions over the years on where dentistry is going. Where are we heading?
Well, Stan, thank you so much for the opportunity to talk about this subject that we really are looking at as one of the most important things we can do. And this is the future of dental medicine. I've been a dean and I've been an academic for all of my life, and I really have not experienced this type of excitement, the amount of learning that's going on, the achievements that we have.
Yes.
And I'm very inspired by that. I now am looking at some of the changes that we're looking at, and I think there are two things that I'd like to talk about. One is the technology and how that affects dental education and practice, as well as our place in the continuum of care as far as dental care is concerned. The first piece, we have a wonderful collaboration with Cleveland Clinic and Microsoft, Case Western Reserve, and we are working with Microsoft's HoloLens technology, and that technology is the first untethered holograph computer, and that allows us to see holograms as well as the surroundings within the room. So it gives you a tremendous amount of teaching abilities as well as the ability to have patient education. So if you have a patient you want to explain something to, and it's hard to use a pencil and pad or a plastic type of model, we can have that patient use these visors and travel to the source in which they have a problem with and either heal the situation or not. So you see the sequelae over both. It's a wonderful technology. And the other piece is regarding the continuum of care. We are collaborating with Cleveland Clinic and producing the health education campus. Right. And that is a campus that is promoting our strong beliefs in interprofessional education.
Right. Fantastic.
Yes.
So, Dean Chance, you've said it all 100% correct. The work you're doing is great. The challenge we have is to communicate to the wider population why there is a direct correlation between good oral care and good health care, why wellness and prevention is so much connected to the NCDs, and of course oral care is one of the very important NCDs. How do we get the world to understand this? Because there are some that understand. Government officials don't understand. Maybe they're busy with other things. Insurance carriers don't understand. Certainly even human resource departments don't understand. So what can we do?
Well, that's a great question, Stan. People forget that the mouth is attached to the body.
Yeah.
And our evidence-based approach and research approach has provided overwhelming results concerning increased outcomes and increased satisfaction with the use of our teams and the individuals that we use to try to address these issues. The ability to have the oral and systemic situation is very, very, very complicated, but researchers are on top of that right now. And we are proving that, and we're trying to get individuals involved as we see it.
Right. Because we are sitting on information that if the public knew about it, there'll be more support for oral care. And oral care is not about just the drilling and the filling and the smile. It is so much connected to the body.
It certainly is. And when we look in terms of the overall testing that we do,
right.
Be it saliva testing, glucose, cholesterols and the like, they point to a condition that oral health is very, very important. Right. We know that as far as diabetes are concerned, when we look in terms of total treatment, periodontal treatment, we can reduce $1,800 a year by just doing proper maintenance. And all of these things, chronic diseases that we have, obesity, hypertension, are directly associated with reports of oral health components.
Even obstetrics.
Absolutely. Absolutely.
So I don't want to give you homework, but to me, Cleveland Clinic has such a good brand in the medical world. Your dental school, your graduates are the finest. We need to find a way to get this into the media. How do we get the media to say, you know what? We need to listen to the people at Cleveland Clinic. We need to listen to Dean Chance and his people. We need just to get the word out that oral care is not about drilling and filling. It's not an elective need, but it's really required to have a better life.
That's exactly right. And our curriculum is pointing to that.
Great.
We have the HEC, which is our Health Education Campus, as well as our technology to allow to make this case for us.
Great.
And we are looking for others to help us do that. You have been tremendous in the effort of helping us try to get the word out.
Right.
The word is there. We're doing it every day.
Right.
And we can see that outcomes are being increased as we go forward.
Fantastic. I mean, the setting you have at your university, by the way, and the beautiful environment of working so closely, physically, and from an education point of view with your medical school is a role model for how other healthcare institutions should work. And so I would like to congratulate you on that.
Well, thank you so much about that. You know, we have a curriculum that includes our medical school, our dental school, and our nursing school, and our social work school.
Yes.
So when you see all of the indices that each and every profession brings to bear, we have a real synergy of ideas, synergies of ways in which we learn and address different issues. For instance, we have programs that identify the ways in which people are looking at the issues of continued success regarding these types of things.
No, the whole notion of you're doing just a remarkable job. I was most inspired when I visited with you and saw how you were relating to your students and explaining to them, and I saw it when we were walking around the campus and at your graduation, the direct correlation between oral care and medical. The other area you spoke about is technology, and I think with your new facility, when it's up and running, and I know you're working on it right now, is going to be a showcase from a technological point of view.
There's no question about it.
Right.
And it's going to be the top of the line. We have so many different collaborations, particularly yours.
Right.
And the type of patients that we have are the ones that really are underserved, and as well as those that meet all qualifications. So we look forward in providing that service for them.
Right. I think one of the reasons why you get such top students is because they understand that you are a university on the leading edge. in terms of technology, in terms of your curriculum. And I have to congratulate you on that as well. And we find it very nice to work with you because your faculty are so enthused about technology, and of course, your students are really hungry.
Yes, they are. You know, we have the best students in the world.
Yeah.
They come from all over.
Right.
And they want to really deal with the new paradigm, which is the paradigm in which we work hand in hand from the beginning, understanding one another, respecting one another, looking in terms of the challenges that we all face.
Right.
And they're right on top of it.
Well, I think in that regard also, the work you're doing in supporting communities that cannot access care in the way maybe the middle-class suburbs can. And the work you're doing in that area is something that is very, very important. And I, of course, really appreciated by the communities that you serve.
That's right. We have the Healthy Smiles program.
Yes.
It's a really bastion program that we
Excellent.
do have. And we have the Lifelong Smiles program that works with geriatric patients. So we have one gamut from young people all the way to older people. And it really, really serves the need because they would not have had the success without it. We have Give Kids a Smile program.
Right, you're a big supporter of, have been.
Yeah. That's right. And all of the organized dentistry pieces that we involved with. And we just try to find ways in which we can make a difference in the communities.
Yeah.
With this new clinic that we're having, that community relationship will be all important.
Well, you know you can count on us. But of course we do it not only because it is the right thing to do from a community point of view and for society in general, but we do it because we come in contact with your most enthusiastic faculty and your students. They are really enthusiastic.
Yes, they are. Yes, they are.
Highly motivated.
To be there. Dentistry is a wonderful profession.
Absolutely.
It allows people to really make their mark,
yes,
as well as help people in all parts of life, all forms of their lives. And we really promote the individual and their pursuit of either going into research or going into teaching or going into practice. It's a wonderful way in which they exhibit these gifts that they have and help others at the same time.
Yeah. So you have actually, you've stressed, of course, the research, but the clinical and academic sides as well,
exactly right.
which your university is known for. And your graduates are all over the country. Yes, and are doing good work. Many actually in underserved communities. And you're to be congratulated on the values that these students learn and feel compelled to follow as they graduate from your school.
We have the most wonderful faculty and staff.
Yeah.
And our alumni are all over the world. And we see them and they really meet the mark and leadership wherever they are.
Right.
It becomes a wonderful trek to see what they're doing, and they're always doing something different and something better than they would ever do.
And even though the winters are pretty tough in Cleveland.
Yes, absolutely. But again, like you said, the weather is being very, very good to us.
Yeah.
And we appreciate that and we enjoy it very much.
So if there's any way, of course, that we can help you advance the two key components we'll be talking about. One is the importance of oral care in the continuum of care and the digitalization of healthcare. You have the credibility for us to work with others on the commercial side to bring resources to work with you, because what we do know is if you commit to do something, you do it.
That's exactly right. Thank you so much. You've done so much for us. You didn't just start now. You've supported us in all forms, and we are deeply appreciated for all that you've done, and look forward to a stronger relationship.
Excellent. And what we do know is that if you say you're going to do something, you do it. And that's why we are ready to bring others from the commercial sector in to support you.
Well, thank you so much.
Thanks a lot.
Forward to it. Okay.
Have a good
Chicago midwinter.
Wonderful.
Thanks,
Thanks,
you.
Chance. Bye.